everyone. Thank you for joining us. I'm Annie King, President of National PTA, our nation's oldest and largest child advocacy association. To be inclusive this evening of everyone who might be joining us who cannot see this session or is visually impaired, I'd like to share that I'm a light-skinned Black woman with shoulder-length dark brown hair. I'm wearing a maroon sweater, maroon glasses, and I have on these cute big silver hoop earrings. Today is Mental Health Action Day, a day that was focused to shift our mental health culture from awareness to action and spread the message that just like our physical health, we can take actions to improve our mental health. And there could not be a more urgent time for this. We have been saying our nation is facing a youth mental health crisis. And recent data from the CDC's Division of Adolescent and Schools Health Youth Risk Behavior Survey, or YRBS, made this evening more real. Findings from the survey should show that adolescent mental health continues to worsen. In particular, female students are experiencing substantially more violence, poor mental health, and suicidal thoughts and behaviors than their male peers. And they also are using more substance. Disparities between LGBTQ plus students and their heterosexual peers also remain significant and concerning. In addition to the findings from the CDC survey of youth, National PTA has been surveying parents with support from the CDC Foundation and found that parent support for mental health resources and services continues to grow. Parents might want to be active participants. They absolutely do when it comes to their child's emotional and mental health, but they have difficulty finding mental health supports, particularly in their schools. It's critical that we make sure that all of our families are aware of and have access to mental health resources, programs, and services, and are engaged and included in decision-making right there in front of them when it comes to their child's emotional and mental health, and that they are empowered to make mental health a daily priority. And that all works for us. And when we work together to create learning environments where all of our students feel safe and supported. Our children are the future of our country, and it is essential that we help them reach their full potential and carry on our nation into a brighter future. They are our future. The phrase, "it takes a village to raise a child," is so true in so many ways, including when it comes to supporting their health and well-being. As a PTA leader, I have seen firsthand how powerful it is when parents and educators, our school administrators, community leaders, and more come together for our kids. It makes a big difference. At PTA, we remain committed to bringing families together, schools and communities, and bringing knowledge, tools, and resources into the lives of our amazing families to help them navigate through the challenges and thrive. Our mission and work is to make every child reach their full potential through education, health, safety, and well-being. And we want to make sure that their reality is more important than ever. This town hall is part of these efforts. As we dive into the important conversation, I'm pleased to be joined by Dr. Kathleen Ethier, Director of CDC's Division of Adolescent and School Health. Dr. Ethier was a wealth of public health experience and leadership in addressing health issues of youth and women, as well as supporting program improvement, strategic programs, and monitoring and evaluation. Taking a school-based health promotion and disease prevention approach to adolescent health, CDC's Division of Adolescent and School Health is focused on promoting environments where youth can gain fundamental health knowledge and skills, establish healthy behaviors, and connect to health services. The division also builds strategic partnerships and works to prepare healthy youth for a successful future. One fun fact about Dr. Ethier. Let me tell you how amazing she is. She's been an amateur genealogist for about 30 years, in particular, helping connect adults who were adopted with their birth families. Isn't that amazing? Oh yeah, she also likes to crochet. So let's welcome and give a big thank you to Dr. Ethier for joining us this evening.
Thank you so much, Anna.
Well, thank you for being here. You're so amazing. Thank you for sharing your fun fact with us too. As mentioned, National PTA has been surveying parents with support from the CDC Foundation on topics that are important to children's education, health, safety, and well-being. Making sure the voices and the perspectives of parents are heard is top priority for us at PTA, and it's important to our efforts to support all children and our families. As the director of the Division of Adolescent and School Health at the CDC, are there any findings from our research together with the CDC Foundation that have surprised you in the past 1 to 2 school years? And what do you see as bright spots eliminated by the research over time or points of hope in moving forward?
Yes, thank you so much. As you mentioned, we've been seeing this growing mental health crisis among young people over the past decade. And this is so concerning. At CDC, we've been really focused on investing in solutions to address adolescent mental health with really increased urgency. The research that we at CDC have worked on with the CDC Foundation and you at the PTA show us that parents are also, unsurprisingly, very concerned about their children's mental health. We know that schools are on the front lines of the mental health crisis among young people and really can serve as an important source of support and connection. The findings from our research together, it was really reassuring to see that the majority of parents really do believe that school can be a critical part of the solution. That data made it clear that a large and growing proportion of parents believe that school should be places where their children's mental health and emotional health are supported and promoted. That's really a bright spot for me because it highlights an opportunity for schools and parents and communities to really come together and to prioritize the mental health of our nation's young people. It also points us to specific areas where this collaboration can be strengthened. I really appreciate being able to hear directly from parents through these survey findings to make sure that the solutions are informed not only by the challenges that we see in the data that we collect from adolescents, but also by what we're hearing from schools and what parents are telling us are their top priorities and their concerns for their young people.
Thank you. Amazing answers. My goodness, I love the fact that you love talking to parents. And so that goes on to our next question. While we've been surveying parents, CDC Division of Adolescent and School Health has been surveying youth through your Youth Risk Behavior Survey, or YRBS. Could you share some of the findings that the CDC is witnessing in your research and perhaps explain why and what the YRBS is and why it's important for states, districts, and families alike to participate? In particular, what you have learned from the latest research about the emotional or mental health support needs of our nation's children, particularly for girls, and where do we go from here? So it's a two-part question.
Sure. Well, let me just start by talking a little bit about the Youth Risk Behavior Survey. It's a school-based survey which collects data on key health behaviors and experiences among high school students. It's conducted at the state, the local, and the national level every 2 years. YRBS is really an important tool because it really helps us understand students' current experiences and then also to be able to monitor changes over time. It helps us identify emerging issues and then develop solutions and programs that address those issues to improve adolescent health and well-being. Unless we have this kind of data, we just don't know what's happening with young people. And so this just allows us to really be able to identify those issues. In our latest 2021 National YRBS data, as you mentioned earlier, we learned that adolescent mental health overall continues to worsen. And also that female students are experiencing particularly high rates of depressive symptoms and suicidal thoughts and behaviors. And we see similar disparities for LGBTQ plus students. So for instance, in 2021, female students were nearly twice as likely as their male peers to experience depressive symptoms. And they were also about twice as likely to seriously consider attempting suicide. LGBTQ plus youth were also nearly twice as likely as their heterosexual peers to experience depressive symptoms, and nearly 4 times as likely to attempt suicide. Female students and LGBTQ plus students are also experiencing particularly high levels of violence. For instance, in 2021, 18% of female students experienced sexual violence during the past year, and LGBTQ plus students were twice as likely as their heterosexual peers to miss school because they were concerned about their safety, either on the way to school or at school. So these data are really telling us that youth need safety, support, and connection. We know that when youth feel connected to people at school, when they feel that people at school care about them, care about their success, care about their well-being, their mental and emotional health is better, not just during adolescence, but long into adulthood. So it's this really powerful protective factor. At CDC, we use school-based solutions to address the concerns that we're seeing in the data. We partner with schools to create safe and supportive and inclusive learning environments to develop quality health education that teaches students key skills like consent and to link students to needed services. But the work that we do in schools cannot happen without supports from parents, families, and communities. They really are our most important partners and can so bolster schools as they work to promote the mental and emotional health of their students. It's really going to take all of us together to address this crisis from all of the places where we sit and where we can affect change.
I totally agree. It takes the village to do the work. That family-school partnership is extremely important. Thank you for sharing that. In our research with the CDC Foundation, 63% of our parents reported being familiar with the school's process for identifying emotional and mental health needs, while 45% of our parents rated their child's school excellent or very good. When it comes to identifying students' emotional and mental health needs, what role can family engagement play to help inform school decisions related to school-based mental health services and supports offered at our children's schools?
Well, families and schools each play kind of a unique and complementary role in supporting young people's mental health. For example, parents may identify kind of a range of signs of mental behavioral health challenges with their child that school staff aren't seeing, or vice versa. So, oftentimes teachers will see things in classrooms, or school counselors will see things with students and be able to let families know that this is happening. Parents can really increase schools' understanding of challenges facing students, identify potential gaps in support, act as champions as needed for school-based services and supports. But that's really why it's so important to strengthen those positive relationships between schools and families so that that communication can really happen. And by doing that, we not only increase parents' familiarity with what schools are doing, but also to strengthen the community of support for students. So they are getting support at home, they're getting support at school, and getting support in their communities.
I totally agree. Well, here's another question. National PTA's recent survey with the CDC Foundation found parents want to be active participants when it comes to their child's emotional and mental health. What support does the CDC additional research reveal about how parents and caregivers can support the well-being of the mental health of their children?
So we know that the more that parents are engaged with their children, sometimes that's called parental monitoring. It means knowing where your kids are, who they're with, what they're doing. We know that parents who kind of know those things, which means their kids are telling them, so that relationship has been built. We know that when parents are engaged in that way, young people are less likely to experience violence, have better mental health, have fewer suicidal thoughts and behaviors, and they also use less substances. Previous research has shown really the power of family connectedness. We talked about school connectedness before, but family connectedness has kind of similar and equally powerful impact. Again, not just on how young people are doing during adolescence, but well into adulthood. So we know that this sense of connection, when young people feel connected to their schools, they feel connected to their families, they feel safe, they feel supported, we see these long-lasting protective effects related to mental health, violence, sexual behavior, and substance use. So really increasing both family connectedness and school connectedness really promotes the mental and physical health of young people and for over the long term.
I agree. The connection is extremely important. Mm-hmm. Last question. How can our viewers today, well, this evening, and on the West Coast and this afternoon, learn more about the state of adolescent mental health in their states or communities? And how can they best access your agency's resources?
So the best way to get to our resources is obviously through our website, cdc.gov. We've also shared some specific links that will guide you to our recently released Youth Risk Behavior Survey data, more information about our What Works in Schools program that really supports adolescent health and school connectedness, and resources for parents. You can also follow the Division of Adolescent and School Health on Twitter, which is at CDC_DASH. And whatever we can do to help support parents as well as their communities and their schools, we are so happy to do.
Well, this has been amazing, and thank you for sharing this important information, Dr. Ethier, and for joining us this evening. Thank you for your work that you do at the CDC Division of Adolescent and School Health, and the work that you're doing to help youth gain health knowledge and skills, establish healthy behaviors, and by connecting them to health services and prepare them for a successful future. That is extremely important. And so thank you again, Dr. Ethier.
Thank you so much for having me.
Well, you are amazing. So thank you for being here. I now like to introduce a special guest whose life mission is to help our nation's children and schools be the best that they can be. U.S. Secretary of Education, Dr. Miguel Cardona, has 2 decades of experience as a public school educator. He understands the challenges and opportunities facing our nation's students, families, and the educators, including in the area of mental health. Please join me in welcoming Secretary Cardona to share some remarks.
Good evening. Thank you to all the parents, educators, and advocates joining as we recognize Mental Health Action Day. Awareness is the foundation for action. Thanks to the National PTA for your recent survey about how parents are working with schools to get mental health supports for their kids. These data provide important insights that build on the growing consensus that mental health matters. Because learning can seem downright impossible when a student feels depressed or anxious or even disconnected from schools. The fact is, our students, especially our teen girls, are facing a mental health crisis. More than half of teen girls felt persistently sad or hopeless in 2021. As your education secretary, as an educator, and as a father, I feel a great sense of urgency about the challenges before us. But I also feel hopeful about our ability to address them. That's because on days of action like this, we commit not only to recognizing these challenges, but to do something about them. That's where all of you come in. I've talked to thousands of teachers and parents during my time as secretary, in red and blue states, in big cities and small towns. Despite wide geographical and political differences, we all agree on one thing. We got to make sure our kids are safe. We got to make sure they're supported and that they feel connected to school. How do we get there? At the department, we're funding projects that build and strengthen capacity. Projects that provide a comprehensive range of services and connect people to care and to each other. We're partnering with states, districts, and communities, not only to support mental health professionals currently in schools, but also to grow the profession. We know we need to add about 63,000 school psychologists to the workforce to meet recommended ratios. To move forward, we'll need investments, we'll need action, we need all of you. Because parent and family partnerships with schools are critical when it comes to raising healthy, happy, and thriving kids, we've got to continue to build strong foundations between schools and the families they serve, so the families feel comfortable engaging, communicating, and collaborating about their child education and their care. This is especially important today when schools provide more than half of small group and individual mental health services to students. Building leadership opportunities for parents, communicating effectively between home and school, and including parents in decision-making, these strategies connect parents to classrooms, opening the door to conversations about their child's academic progress, their mental health, and their emotional needs. So tonight, let's recommit to strengthening those parent, family, and school partnerships. Let's recommit to action. Thank you.
Thank you so much, Secretary Cardona, for your and the U.S. Department of Education's commitment and passion to support mental health and student wellness. You are one of a kind. Now, I'd like to introduce Amy Kennedy, co-founder of the Kennedy Forum, who will be moderating 2 panel discussions as part of our town hall this evening. Through the Kennedy Forum, Amy Kennedy is leading national dialogue to achieve systemic reform in the U.S. healthcare system by advancing evidence-based practices, policies, and programming for the prevention and treatment of brain illnesses, specifically mental health and addiction. With over 15 years of experience working in the public schools, Amy has seen firsthand how a child's mental health and a mental health literacy impacts their ability to learn and grow, not only in the classroom, but in life. Her experiences as a teacher and a mother of 5 propel her efforts around social emotional learning and mental wellness for children and adolescents. Amy knows that by supporting educators and working with the community partners create robust mental health systems within our schools, it is possible to identify the needs and intervene early. Through strategies like social emotional learning and integrated systems of care that meet students where they are, we have the power to improve educational, emotional, and health outcomes for all children. Amy serves on the boards of the Mental Health America, Interaxon, a mental health technology company, and JED Foundation, which focuses on mental health wellness and emotional preparedness for teens and brain future. Say that twice, that's a whole lot, right? That means that she's pretty awesome. Here's a fun fact about Amy. She loves to paint with watercolors and does murals. She even painted a piece in her school where she was a teacher. So let's give her a round of applause. Welcome, Amy. I will now turn it over to you.
Thank you so much. I'm so glad to be here with you. I'm very excited for these next 2 panels and for the focus today on this topic. We know that May is Mental Health Month, but that this has been a challenging time for so many young people. So I'm delighted that we have Dr. Deborah Howery from the Centers for Disease Prevention and Control, as well as Katie Neese from the U.S. Department of Education joining us today. I am glad to have worked in a school here in New Jersey and had that experience where not only was I able to share my art skills, but hopefully be able to have that connection that we know is so vital and so important. Today, we're going to be talking a little bit more about not only how we can help our educators with that connection and our parents with that connection, that they are trying to develop young people and make sure that they are getting all the services they need, but also finding out how we're connecting between agencies. So I would love to start now with some of the questions we have for our distinguished panelists. We'll be introducing both Katie and Deborah. Our first question is about federal agencies like the Department of Education and Centers for Disease Control and Prevention. They have a unique pulse on what is going on nationally, including being uniquely suited to identify national trends and national solutions. Can you share with us what you're seeing in your own work within the administration regarding student mental health and well-being? And what have been any concerning trends over the last few years? I think we can guess, but conversely, any trends suggesting areas to explore or promising solutions moving forward? So maybe let's start with the first part, what you're seeing in your own work, and then we can talk about some of the trends. Could we start with you, Katie?
Sure, I think we were going to start with Deborah.
Oh, sorry, with Deborah?
No worries.
Sure. Well, thank you. And, yes, I think keeping a pulse on the health behaviors and experiences among youth in the U.S. related to health and well-being is really important at CDC. And to that end, we're seeing troubling trends with U.S. adolescents. And although there are a few behaviors and experiences that are moving in the right direction, the increases in harmful experiences among adolescents are striking. And, as Dr. Ethier alluded to in her remarks in the beginning, some of our recent data have shown that although risky sexual behaviors are decreasing, so are things like condom use and HIV testing. And although substance use also is decreasing, it's too high. And we know that poor mental health and suicidal thoughts and behaviors are increasing for nearly all youth. I look forward to the discussion tonight to just really talk about, a serious concern around girls, as well as gay, bisexual, and questioning youth, that they're experiencing especially high rates of poor mental health.
Yeah. At the Department of Education, I think we rely heavily on the CDC data, and the things that our two folks from CDC have outlined tonight are really very troubling. One of the other things that we find troubling is access to mental health services. And for those reasons, given the shortage of mental health professionals in school, the department has prioritized three things as our marching orders to make a contribution in this time. One is to increase the capacity of professionals in school. We know that there are lots of folks that have provisional credentials who want to do this work, and have the heart and commitment. They don't yet have the credentials, and we want to make that easier for them. We also know there's a shortage of mental health professionals, so we are dedicated to trying to increase the number of mental health professionals who are working in schools with youth. And lastly, we want to increase the ability of schools to pay for these services so that they can be sustained in the long term. So those are the three real big priorities from the Department of Education, which we hope in years we'll be able to reap the benefits of those.
I love that. That echoes everything that I'm hearing and my own experience as an educator who wished I knew more on how to help my students. We know that across the country, there are tremendous inequities in the mental health services and supports available, that some students and families are disproportionately affected and face significant barriers to getting the support they need. What measures or initiatives are the Department of Education and the CDC currently taking to foster student well-being, especially with regard to addressing barriers for certain students and communities? For example, are there efforts to expand access to mental health services through the federal Medicaid program? Or how are your agencies helping to ensure that schools have an adequate ratio of mental health professionals to address the needs within their communities? And you just spoke to that a bit, but maybe you could expand on that.
Sure. One of the things that we are committed to is breaking down barriers between the healthcare system and the school system. And Medicaid is probably the most important program to help us do that. Medicaid covers more than 50% of all children in school-age children. It is certainly in my world in disability policy, it has been the gold standard of a benefits package for children with disabilities because it covers both behavioral health, mental health, and primary care services. One of the things that is driving our work is the most recent CDC report that talked about how important connectedness was to children, and how schools really can be that gateway to connect kids not only to each other, but to community sources and to those health and behavioral health supports that they need. Today, the Department of Education issued a proposed rule change to the Individuals with Disabilities Education Act to streamline the billing process with Medicaid to make the process for families with students with disabilities the same as it is for all other kids. And we hope that will reduce a barrier that schools have found in trying to access that reimbursement source to deliver services that they were required to deliver. We know, like there are shortages with mental health professionals, there are also shortages in special education teachers, in people like speech therapists, and all of these services that kids with disabilities need to be successful in education. There's just insufficient funds to deliver it every time. And so we're hoping that this rule will help schools and Medicaid agencies work better together to be able to access that revenue to support the needs of these students. So we're excited about that. The rule came out today. It's got a comment period through the 1st of August. And you're a geek when you're excited about a rule change about billing to Medicaid, but it's something that really could be very significant for kids and families in schools.
I'll take that geek title too, because I am excited. That's fantastic news. And how about at the CDC? Could you speak on some of the initiatives that you're currently taking on as well to foster student well-being and address some of the barriers?
Absolutely, and I agree with what Katie said about barriers. I think funding and workforce issues are often cited as it can be difficult for schools to not only fund, but to also find mental and behavioral health service providers. And access is often shared as a barrier, as some families are unable to find the appropriate mental health services their families need. I was delighted to hear the shout out about connectedness in schools. That's one of our key priorities around the work we're doing among youth. At CDC, we're really investing in public health related programs for schools because this plays such an important part in shaping mental, physical, and social growth. And we have our What Works in Schools program, which is supporting nearly 2 million students across 28 school districts at a cost of just $10 per student. And this program focuses on creating safer and more supportive environments that protect student mental health, while also supporting quality health education and connecting students to needed health services. And when schools implement this program, we see improvements in student mental health and reductions in substance use, sexual risk behavior, and experiences of violence. And we also have a Healthy Schools initiative to implement and evaluate evidence-based strategies in schools, including physical activity opportunities throughout the school day, promoting daily PE, giving students adequate time to eat lunch, and promoting healthy snacks and meals. I also think starting even a little earlier is important. We invest in preventing adverse childhood experiences, or ACEs. This includes witnessing violence in the community, or growing up in a household with substance use or mental health problems. And we are currently funding 6 different recipients to implement strategies, things like promoting social norms that protect against violence and ensuring a strong start for children. An example I'd like to share is in Georgia, we're already seeing the benefit in youth programs like coaching boys into men and athletes. This fosters the coach-athlete relationship to teach youth about healthy, respectful relationships. I also think it's important to look at suicide and preventing it throughout the lifespan through data, surveillance, and programmatic efforts. And one of our states, Rhode Island, found that they had an increase in young people with suicidal ideation with attempts with over-the-counter medications. They were able to implement a campaign to really focus on that, and the health department provided medication lock bags, received over 1,000 requests within just the first few weeks. And then just wanted to mention, we also have publicly available resources. I know Kathleen mentioned them in the beginning, but things like our whole school, whole community, whole child model is an approach that provides schools with strategies and resources to address these barriers.
That's fantastic. Those are some really great examples. I love what they're doing in Rhode Island to keep kids safe. This is really just so informative, and I'm excited about some of the initiatives that are already happening, including training up coaches and everyone that interacts with young people. We know that improving student mental health and well-being will take all of us working together, not just the coaches, but teachers, policymakers, mental health providers, and of course, parents and caregivers. How are your agencies currently working together across agencies to address the youth mental health crisis? And how are your agencies engaging with some of these key stakeholders?
Yeah. So it's one of the things I've loved most about being a part of this administration is the cross-agency collaboration. When I started in July of 2021, we were still right in the middle of the COVID issues with having kids in school. And what did that mean? And to say we relied on the CDC's partnership and guidance, as well as all the other agencies within the Department of Health and Human Services, is the understatement of the century. We were in weekly, if not daily, conversations about what was the right thing to do. And for the kids that I've represented, kids with disabilities, many of whom have underlying conditions that made going to school more concerning than maybe some other kids. Our partnership with the CDC was beyond invaluable. We've also worked very closely with the Surgeon General's office. And most recently, earlier this month, the Surgeon General put out an advisory that likened loneliness to being as having a negative impact on well-being as smoking 15 cigarettes a day. So I think we're really committed to doing whatever we can to try to help kids wherever they are. And certainly school is that place where kids spend a lot of time. The Department of Education has been working very closely with the Centers for Medicare and Medicaid Services and also announced today a technical assistance guide that's really designed to help state Medicaid agencies and school districts and state education agencies figure out what policies and procedures they really need to alter so that schools can truly access Medicaid reimbursement for the host of services currently available through the Medicaid program. The CMS put out last August an information bulletin that reminded state Medicaid agencies that mental health and behavioral services are baked into the child benefit for Medicaid, and that we really want these kids to get the services and supports we need. And we know that schools want to deliver those services. They just need the people and the means to make it real. And so we hope that this, along with a technical assistance center that CMS is going to award next month, that we're building those foundational pieces to make this work and these services and investment in the personnel necessary to carry it on really be accessible to kids and families in schools.
That's terrific. That's, I can't say enough about the work that you're doing and how much it means to me as a parent to know that this is all happening behind the scenes and that administrators and others are going to have access to this technical assistance that's so needed. So really terrific. Is there anything that you wanted to add, Dr. Howery, about the way that stakeholders are being engaged?
Absolutely. And I would say I very much echo the appreciation for partnerships. The Department of Education has been a tremendous partner for us at CDC. And we've presented, to the National Center on Safe Supportive Learning Environments, lessons from the field webinar series, and give data updates to the Department of Education at each major data release. We know that they are just such an invaluable partner. Across the federal government, we've also worked with the Human Resources Service Administration, SAMHSA, and the National Institute of Mental Health, along with the Census Bureau, to really understand the scope and complexity of population-level children's mental health. And this resulted in a report with national estimates of specific mental disorders, mental health services, as well as positive indicators of childhood mental health. And it has state estimates. And then about 2 years ago, Secretary Becerra launched the Behavioral Health Coordinating Council in an effort to really improve coordination across health and human services and our behavioral health activities. And then within CDC, we actually have about 12 centers. And so we have now established a behavioral health coordinating unit to really coordinate across our agency on things like mental health and substance use. What I would say, though, is it's really all of you today that I really appreciate working with. We're providing funding to organizations to address mental health concerns and using that data to drive programs. We have a drug-free communities program, and we're currently funding over 700 community coalitions. And we've seen great successes, like Trumbull's Prevention Partnership has been working with youth and partners and guardians to prevent youth alcohol and drug use and foster social emotional health and build a safe and healthy community. Just seeing some of the 2021 data, they established a monthly speaker series open to the community that highlights topics around mental health. And I think the partnership, outside of government is just as vital, if not more so. And so we are really appreciative of the work we do with Mental Health America, Trust for America's Health, National Association of School Nurses, and of course the National PTA, to name a few. Partners just really been able to provide on the ground perspective on what is helpful and how we can better support youth.
That is a lot. I love to hear about how people are working together. Can you spread that to some of the other agencies? I think we need the example that you both have set. That was a lot, and I felt like I should be taking notes. I know that this is going to continue to live on the site, and people can go back and hear again all of the great information that you provided. But if our viewers want to stay informed about the ongoing efforts, resources, opportunities from your agencies to foster student mental health and well-being, what do you recommend? Katie?
So I would say follow our Secretary Cardona's social media at ed.gov. To say he is committed to being a meaningful partner in having schools be able to help students where they are is truly an understatement. As an educator, as a parent of 2 teenagers, he is all in on this, and he is our biggest champion in trying to make these policies be implemented with fidelity. So that would be my recommendation.
Thank you. And Dr. Howard?
I'd say our cdc.gov online resources just really provide a rich source of latest data and resources, our social media channels as well. And then certainly the Division of Adolescent and School Health, their website has the latest science and plans and outcomes for school health. Also, the National Injury Center has information on resources for action around things like youth violence and preventing child abuse.
Thank you so much for that information, and thank you both for joining us again, Dr. Howery and from the CDC, and Katie Neese from the Department of Education. Fantastic panel, and I'm looking forward to our second panel, which will be on how parent leaders can champion school-based mental health. So joining me for the next panel, we'll have Alma Lopez, a school counselor, Angela Kimball from Inseparable, and Mary Collins from New York Light Foundation. Thanks for joining me. All right, welcome, welcome. For Alma, could we start with you? And maybe you could tell us about the nationwide survey conducted by National PTA that Anna King mentioned earlier, found that most parents support school-based mental health resources, services, and evaluations, and want to be active participants when it comes to their child's emotional and mental health. But many are unfamiliar with school processes in this arena. So as a middle school counselor in California and the 2022 School Counselor of the Year, congratulations, how do you typically work with families? And what do you wish families knew about your work as a counselor?
Absolutely. Thank you. First of all, I want to start by saying that parents and caregivers, you are absolutely the #1 resource for your child. And so we as school counselors and educators definitely want to work alongside of you as we serve your child in the school buildings. As a school counselor, I typically begin connecting with my families as soon as the school year starts, and sometimes even before during our orientations, definitely making sure that we provide you, parents and caregivers, with the information as to what services are available at school and what services, accessing our services could look like. Usually at the back to school events and the open house and conferences, you will see school counselors and other mental health professionals will set up a table. We definitely want you to stop at our table, ask us some questions, get to know us. One of the things that I take great pride of in doing here in the Central Valley of California is inviting all students in the 7th grade and their parents to have an individual counseling conference with me. We want to get to know you, and we want to get to know your student and be able to work together throughout the year. So if you are offered that opportunity, definitely take advantage of it. And if you aren't offered that opportunity, seek it out. As school counselors, we are in the building and we want to be able to support you and your child. I also work closely with our parent liaison, who is working with parents and caregivers in the community. And so I make sure that our parent liaison has information on how school counselors can be accessed and for what reasons. One of the things that we did when the global pandemic first began is that we moved our in-person parent caregiver coffee connection to a virtual format. And that made it easier for a lot of families to connect with us. And so that's something that I know many schools throughout the country either initiated or are continuing. So reach out to your school and find out what services they have available so that you can connect with school counselors or other educators in the building. One of the things that I wish that our families would know is that there are school counselors in the building. There are school counselors that are available to help your child in the areas of academic achievement, college and career readiness, and most importantly, social and emotional development. We are here and we provide school-wide activities for all students. We provide classroom instruction on some of those very important social and emotional topics. We also have small groups where we host a small group of 7 to 8 students, and we talk a little bit more in depth about some of those topics that are impacting our young people. And of course, we offer one-on-one counseling sessions with our students. While school counselors are not therapists, we are mental health professionals, and we can support your student through their mental health journey, and we can provide resources to community partners as needed. And finally, one of the ways for parents and caregivers to partner with school counselors is simply to maintain the lines of communication open. We are part of your student's educational team, and we can answer many questions and help guide you and your young person during their educational journey. Research has shown that when we work together as a parent and a school system, then we absolutely help our young people achieve greater academic success. And we just want you to know that we're here and we want for you to connect with us early and often. Thank you.
Wow, Alma. Oh my gosh, you set a high bar for all of us. So, and you say, meet with each student one-on-one. I taught 7th grade. To be able to meet with every 7th grader and their parents is pretty impressive. And I love the idea of doing that virtually as well. And Angela, earlier this year, Inseparable published the first ever national report card that scores every state on policies that support school mental health with recommendations for how to improve. I know that you also have states that are doing things well. So that's so exciting to be able to look at those examples. What were some of the trends that this report illuminated across the country? How can parent leaders use this report then to learn about the state of school mental health where they live and use the report to champion school-based mental health in their own community and state?
Oh, thank you for that, Amy. So really at Inseparable, we researched what states are doing to support school mental health. And, while there's more to do in every state, one of the things we learned is that there's incredible recognition across the aisle and across the country that students are struggling with their mental health. And there's this broad recognition that one of the best ways to get youth the help that they need is to meet them where they're at. And that's in school. And at the state level, we're seeing a wide range of initiatives to provide more school mental health supports. In our report card, we look at various categories of what that support can look like. It's important to support students at every level. So there are universal interventions, there are more targeted interventions. Some students need much more intensive support. When you think about what some states are doing, I would say some of the most impactful things that states are doing are simply putting more mental health professionals in schools. States are providing telemental health services, particularly in rural areas, to make sure that where there is a lack of providers, there's still that ability to get students the services they need. And another area that I think is growing in importance and being implemented more is mental health screenings. And I really want to touch on this last piece because mental health screenings, just like screenings for hearing or vision, they equip parents and schools with information about whether a youth may need more support. I think it's really important to mention that screenings are not a diagnosis. They are just an opportunity to spot a student who may be at risk. And just like for any health condition, when students get help early, the outcomes are better. And we know that parents support this. The PTA and the CDC Foundation published a survey recently that found that 81% of parents support evaluations of all students to identify areas where students could use additional support for their mental health. And I think that's because we all want our kids to be safe, healthy, and happy. And parent leaders, frankly, can really help out here. I think when parents speak up about how they value their children's mental health and the mental health of their children's classmates, and that they want all children to get the support they need, that really makes a difference. You know, those parent voices of support for mental health care are really critical to helping communities support every child when they need it most.
That's really helpful, Angela. I think it's so important that we know what we can ask for. And a lot of times we see what's possible by looking to other states and what they're doing well, and being able to bring that right back to our own district or our own state. So I'm sure this report card will be able to do just that for people who are viewing. Maria, we know about grief and loss and that it's affecting many children in the United States. In fact, about 1 in 14 will lose a parent or sibling before age 18. Nearly all youth experience a close personal loss by the time they graduate from high school. New York Life has launched a groundbreaking program called the Grief Sensitive Schools Initiative to better equip educators and other school personnel to support grieving students. How does the initiative work to improve the ability of schools to support grieving students? And how can parents and schools get connected to this work to build grief-sensitive schools in their own communities?
Well, first and foremost, thank you for having me. I'm happy to represent, New York Life, the foundation, and the work that we're doing with the PTA and others across this field. So I want to start with just level setting. You did mention a stat. I'm going to update that stat. We developed a stat with Judy's House to understand how many children are actually affected by the death of a primary caregiver or sibling. And today, in 2023, 1 in 12 children will experience the death of a parent or sibling before they leave high school. Now, that statistic has unfortunately increased over the time it was developed in 2018. So in 5 years, it went from 1 in 15 to 1 in 12. In addition, we developed the Grief Sensitive Schools Initiative based on research that we did with the AFT and others. And in 2012, 92% of educators said this is a serious problem that deserves more attention. And they wanted grief training. However, only 7% of educators stated they've received grief training, and 3% of districts offered. We followed up in 2020, and we found, one, that statistic of wanting more grief training has not changed. It actually went up 1%. It went to 93%. Also, we think that our Grief Sensitive Schools Initiative, which I will explain, also had an impact on how many people are receiving it and how many districts are offering it. So in 2020, it went up. 15% of educators did receive bereavement training, and 12% of educators said their district offered bereavement training. So we do think we are moving the needle on that. And really, the Grief Sensitive Schools Initiative is very simple. And I only say that is that it's about awareness. Knowing the issue is really important. So the Grief Sensitive Schools Initiative, we train our workforce to go into schools or school districts or communities and really explain, one, the prevalence. Starting with that, level setting that, because it looks different in every community, every state. And if you want your state, actually, if you go to judyshouse.org, you can actually look up the childhood bereavement estimation model, and you can find your statistic for your state. Second, where are the resources? How can I connect a child and a family to resources? So that's the second thing we did. So we launched something else. the Coalition to Support Grieving Students. And we brought together 10 associations from the school community. So the AFT, the NEA, the school counselors, social workers, psychologists, school nurses, superintendents. We all started in 2013, and we're celebrating 10 years today, and we still meet today. We just had a meeting last week to really develop a resource that any educator, anyone in that school building, anyone in that school community can use to support a grieving student. And several people have mentioned this. It's not about being the counselor. It's actually providing that safe space for that young people to be seen, heard, and recognize that this impacts them. Because we do know from research, if not supported, and I think I want to really clearly say that, if not supported, a child that has lost a primary caregiver is actually, the grief can impact their learning, can impact their social interactions, academic performance, behavioral problems. So really that Grief Sensitive Schools initiative is about, one, disseminating information, increasing awareness, and getting resources in the hands of the supportive cast. That's all of you, parents, educators, after school program. And what parents can do is really, in getting that Grief Sensitive Schools initiative to there, is actually go to the New York Life Foundation website and request a presentation. Or if they know a New York Life person or office, they can actually request that a presentation is there. Because not only do we give that presentation, we follow up with resources and training. So we do work with the National Center for School Crisis and Bereavement, and they provide training both virtually and in person, depending on the need of the school district. And one last thing I want to mention, because we're speaking to parents, and I think it's super important. We know parents are a protective factor, but also they're grieving. If their child is grieving, they're grieving. And we have to be cognizant of that. And how do we support them? So New York Life has partnered with many organizations, but I do want to mention one because it's accessible. Life is so busy. We're all running around, just taking care of our children, going to work. Sometimes we do need, how can I support my child? How can I support myself? So we partner with the Arizona State University to develop the Resilient Parenting Program for Bereaved Parents. Say that 3 times, right? And if you go to bereavedparenting.org, you can find that resource, and it's really an online, short, free, accessible on better parenting based on 15 years of research on how to really, one, cope yourself, but also help your child have that new relationship with them after the loss of your significant other and one of their primary caregivers, their other parent.
Wow, Maria, that sounds like something that we all could benefit from, honestly. You think about that grief training and resiliency. We could all use a little bit of that. I can't tell you, this is where Alma comes in. I can't tell you how many students were going through something in their life, and as their teacher, I didn't know. And so that's the piece where I encourage anybody watching, reach out to the counselor at the school, and just if as long as you're willing to share that information, educators would love to know, the staff at the school would love to know that that student's going through something, so that we can just be mindful of that. Whether it's, I had a student, I remember one year, who's had a house fire, and we didn't realize that the family had not let the school district know, but it came out later, and we thought, man, that's going to impact, just, do you have your homework the next day? Simple things that the communication is such an important part, but also knowing how to best support that student. And that was a fantastic conversation.
Can I mention one other thing? Because you mentioned something about identification. So there's no systematic way to identify a bereaved child. We know the prevalence, but we don't know who the actual children are. And actually, New York Life with the Children's Collaborative, actually next week, will be launching a pilot in Utah to actually try to systematize finding these children. It's an opt-in, and we're working with a school district, and we're having of course, Utah PTA as our partner to really identify these children. But once you identify them, it's linking them to the actual resource. And it's not just bereavement resources. We are looking at all resources, financial, because that's a big piece when you lose the primary caregiver. So look for more information about the Children's Collaborative to support bereaved children and identification project that we're doing, because I think this is a model that can be replicated in any state once we learn how it's done and ensuring that the resources are there.
I love that. We will definitely look for that, as well as the Hopeful Futures Inseparable Scorecard, report card for states. And with that, I am going to hand it back over to Shatan Berry, who is going to wrap it up for us tonight with so much to think about. Thank you.
Thank you, Amy. Hello, I'm Shatan Berry, Ambassador for National PTA's Healthy Minds program. I like to share that I'm a brown-skinned Black woman wearing black glasses and a coral blouse. As Mental Health Action Day is focused on spreading the message that just like our physical health, we can take actions to improve our mental health. National PTA is focused through our Healthy Minds program on helping families make mental health an everyday priority. When our minds are healthy and strong, we are more resilient to life's challenges, able to use healthy coping methods, have better relationships, and maintain our overall health and well-being. That is why it's important to be proactive about our mental health. On our website at pta.org/healthyminds, we have tools and resources for both PTA leaders and families to learn more about how to have and promote healthy minds. A big part of this is talking openly with children and having regular family conversations about how everyone is feeling and what they think about current events, the school day, and any family news. It is critical to talk through children's feelings or concerns, things happening at school and with friends, or how current events are impacting them, and to share your own feelings and challenges too. These conversations will help you learn how your children are doing emotionally, builds their ability to cope with life stresses, and shows them that their feelings matter. It also helps them understand that they are not alone. As parents, we struggle too. Over time, this builds trust and helps children realize they are loved and supported. As we move forward from today, Mental Health Action Day, we hope that you will take action with the knowledge and resources shared during this town hall and through National PTA's Healthy Minds program to make mental health an everyday priority and help create safe, supportive learning environments for all students. As we close, I want to thank all of you for joining us and for your commitment to making a difference for the education, health, safety, and well-being of every child and making every child's potential a reality. I also want to thank our incredible speakers, moderator, and panelists who have shared their perspectives and passion with us. And thank you for your commitment to improving our youth and our nation's mental health. I especially want to thank the CDC Foundation for supporting this town hall, the research National PTA has commissioned with parents, and our Healthy Minds program. I also want to thank New York Life Foundation and Allstate Foundation for supporting National PTA's Healthy Minds program too. Before we go, I would like to leave you with my vision of the future to move our work supporting Healthy Minds forward. It is imperative that as an association and as a society, we prioritize mental health, not just for our young people, but for our adults as well. We have to work together in unison to dispel the myths and stigmas associated with mental health in our schools and local communities. We want to ensure that all of our nation's students are welcomed every day to a safe and supportive school environment. Let's lead the way in reducing the number of undiagnosed and untreated mental health issues in our young people and our families. We need everyone to embrace and commit to living every day with a healthy mind. Thank you again for joining us. Together, we can address this crisis and improve the mental health of our youth and our nation. Thank you again.